Welcome to SCM Admission Medication Reconciliation online training for St. Clair Hospital. This short 5-minute review session is to prepare you for your personal hands-on training while rounding at St. Clair Hospital. In this video, I will review the process and actions of SCM Admission Medication Reconciliation. When seeing a newly admitted patient, please review the admission medications by clicking on the Order Reconciliation icon. Select the admission. In most cases, it will have already been accessed and saved as incomplete by an ED physician or nursing staff. If you are a physician extender, you will need to click on the Order Entry Requested By icon. Current providers. Select the provider you are working under and always select the source as CRNP, PA, CPOE. Click on the OK button and we're ready to start. The patient's current home orders will be listed on the left-hand side of the screen. If the patient was admitted through the ED physician will have already ordered the essential medications. You will see them pulled over to the right-hand side of the screen across from the home med. You will also notice that the red star will have turned into a green check mark to signify that the medication has been reconciled. To address the remaining home medications, click on or hover over the medication tile. Click on the black Actions arrow and select the action needed. To continue this aspirin order, I'm going to click on the Actions arrow, hover over the Continue action, and select the dose from the flyout menu. To ensure ease of use, when given the opportunity, always select the dose with ORM and the frequency labeled after it. When continuing a medication with the Continue As action, the medication will be in bold. Just click the bolded med to continue as an inpatient order. If you know the patient is no longer taking a medication, marking it as so will remove it from the patient's home medication list so it does not get reordered on discharge. This Lantus is no longer being taken, so I'm going to click that option and it'll put a line through it on my home medication list. When continuing a medication that is part of an order set, the order set will automatically open. Review the orders on the order set, select the appropriate medication, and select the OK button. This will then create all of those orders as inpatient orders. It is unnecessary to take action against any medication you are not going to continue for inpatient use. Please also do not continue the spontaneous aerosol treatments from admission reconciliation. Always use the Enter Order icon at the top of the screen to enter spontaneous aerosol treatments, code status, and VTE prophylaxis. Select the Return to Order Reconciliation button, and it will put you back onto your admission reconciliation. This Lasix order is an example of a medication that needed follow-up in the emergency room. The ED physician marked it as needs follow-up. The nurse then followed up and got the correct dose of the medication. To continue this medication, click on the Actions arrow and click on the bolded medication name. When continuing eye drops, please always select the affected eye. This is an example of a drug interaction warning. The warning is telling us that there is an interaction between the eye drops that we just ordered and another medication that's on the patient list. To proceed through and continue to order these eye drops, click on the Proceed button. If this has changed your ordering process, click on the Go Back button and it will let you not continue that order. When your list is complete, select the Marked All Reviewed and Reconciled. This will remove any orders that you have not addressed. Please save the admission reconciliation as complete if it needs no further modification, and incomplete if you will need to access this medication list at a later time. By using the admission reconciliation process, we are able to efficiently review the patient's home medications and order the needed medications for inpatient use. Thank you for your participation in this online training. Please call extension 8600 from a hospital phone for further assistance with this process.